Hey, this is a Hakawati production. Hey, welcome to the show. How are you feeling today? What's on your mind? Is there something you can't stop thinking about starting from the moment you open your eyes in the morning? Well, if the answer is yes, you're not alone. Some studies have indicated that as many as 47% of the US adult population suffers from some form of an addictive disorder. And since we're all human, I'm guessing that number isn't so different in the Middle East. If you're lucky, you might be addicted to exercise or work, which isn't so bad. But maybe it's something that messes you up, like maybe you can't go to a nightclub without doing cocaine or taking ecstasy. Or maybe you can't stop smoking or drinking gin and tonic, let's say. Whatever it is, there's a doctor for that. And we have one on the show today. Wait, did you subscribe yet? Now's a good time. Dr. Farid Talih is a psychiatrist at the American University of Beirut Medical Center who specializes in addiction and sleep disorders. Hello, Dr. Talih.
Hello.
It's great to see you. Thanks for coming in.
It's my pleasure.
It's like I'm your doctor today. I'll be asking all the questions.
Yes, it's unusual to be on the other side.
Are you ready?
Yes.
So I see you've shaved and everything. That's good.
I'm well prepared.
So are we as human beings all predisposed to being addicted to something?
Definitely any human or actually mammal is predisposed to potential addiction. So it is somewhat hardwired into our brain to develop addictions.
So do animals exhibit addictive behaviors?
Yes, they do. And actually, most addictive addiction medicine research is performed on animals that are habituated to a certain drug, like you let them eat cocaine-infused food, and then you see what happens to them, you stop it. Or if you want to try a medicine to stop the addiction, you make the animals addicts, usually mice.
Mm. Have you done that yourself?
We do not do this type of research, but it's widespread.
So they eat common. The cocaine. They don't have to sniff it.
They can. Actually, the most common way is to infuse it as a liquid.
Okay.
So like a sugary fluid, and they just drink it.
And they basically have similar behaviors to what humans would have?
Yes, they become, obviously we cannot detect the psychological changes because they cannot express themselves, but they do become more irritable, more restless, eat less, fidget more, they can fight with each other. So definitely you see the physical behaviors.
Okay, so tell us about your practice. What percentage of your patients are drug addicts?
So I run a general adult psychiatric practice, so I see all kinds of patients. But definitely we have a significant number of people who are coming with a main issue of addiction. Today, actually, most of my day was dealing with people who have addiction. And today we have, I can tell you a little bit later, we had our group today. So we had a bunch of people coming in, and they have a group session.
Oh,
so
kind of like Alcoholics Anonymous
similar,
kind of thing?
Yes. So we have, I'd say maybe around 10% of my clinic population is somewhat addicted to something.
Okay. So today you had them all come in, you had a group come in?
Yeah.
And how does that work?
I don't participate in the groups all the time. I have more like a supervision type role. But we have a nurse and a therapist and a co-therapist, and they sit in a large meeting room, and we have on average 6 to 8 people in our program, and they sit and they have general discussions. They update each other on their progress. People support each other. The nurse can answer medical questions if somebody's having physical discomfort, and the therapists guide or, let's say, facilitate the session.
And what's the average age?
In the system we have, the people tend to be younger. Most people who come to treatment are either younger or middle-aged.
What do you mean by younger?
We're
are we talking
early
12-year-olds?
No. We don't
18-year-olds?
Have a significant adolescent addiction problem in Lebanon, although it's evolving. But I would say early 20s. Mm-hmm. Early 20s is probably the most.
Yeah. But also you would think that even if they try it at an earlier age, it takes a few years before you really.
So most problems kick in the early 20s.
Okay. And at what point do they come and see you? Is it when their lives kind of start falling apart?
Yeah, there are many paths in which you end up in addiction treatment. It could be legal. Sometimes in Lebanon, you might be arrested, even if you're just a casual user. and the judge would say, you go to jail or you go to treatment. And 99% of people will choose treatment. So these are involuntary sometimes, but they just come because they have to. Some people are brought in by family. And they are somewhat hesitant, like a wife who thinks her husband is drinking too much, and then he says he's not, and it becomes a huge debate. Sometimes parents bring in kids. I had a parent bring in a kid today. Kids, usually younger kids, are usually not very cooperative. They're like sulking, and they think their parents are like just being weird, and everybody's smoking or doing, and you're just like old-fashioned, and they're usually not very cooperative. They're actually the most challenging people are the younger.
Like 15-year-olds.
Yeah, like older a little bit, like 11th, 12th grade. They're usually know-it-alls, and they are very resistant.
So what are the most prevalent drugs that you see?
In Lebanon, in the population, we see like around Beirut, let's say college kids or high school students, cannabis is the most prevalent in all types, hashish, marijuana, or even some edibles, which is not very common in Lebanon, but it's becoming a trend. So by far, cannabis is the most commonly used substance.
But I mean, is it really addictive? Like when you hear about people who are addicts, it's usually cocaine, heroin. Do you really see a lot of people who come in, they're addicted to marijuana or hashish?
This is actually, it's interesting you brought this up because it is actually an interesting point that many people are not aware of. Cannabis is definitely not highly addictive, but statistically, globally, around 10% of habitual cannabis smokers will become dependent, and then they cannot stop smoking, and they need to escalate the smoking. So if you have like 100 kids, 10 of them are, and they all smoke, 10 of them are probably going to keep on smoking, and the smoking will escalate. And when you start smoking heavily on a daily basis, you do have problems, functioning, school, work. Some people develop like symptoms like bipolar. And usually the parents are alerted to the behavior. They bring the kids into the hospital or something, and then they test them that they test positive for cannabis. So definitely it's not very common and not well known, but it does happen.
Do you think that Lebanon is representative of the whole region in terms of the types of drugs that are being used and the number of people using drugs?
In Lebanon, if you look at, let's say, the Middle Arab region,
Yeah.
There are regional differences. Like in Gulf countries, cannabis is not very common. It's hard to get. So
It's hard to grow in the desert too, although that's changing, thankfully.
Yep. And it's hard to import because of the strict laws. So people tend to use pills more in the Gulf. Painkillers, sedatives, muscle relaxants. In countries like we see in Egypt and some areas in Syria, people take pills. They're widely available, very cheap. You can buy them without prescription. In Lebanon and North Africa, because of the local availability of cannabis, it's heavily used. So in Lebanon, it's available, it's cheap, it's good quality, so it's easy to get. Obviously we do have many other types of drugs and substances which also are problematic, and we cannot forget about alcohol. Alcohol is obviously socially acceptable and it's legal, but there are people who have alcoholism, and we see that more in older usually populations. Where mid-40s, it's when alcoholism starts to kick in. Usually starts earlier, but it takes time.
So you're a psychiatrist.
Yes.
So why do you think that is?
There are many reasons. Actually, some people are a genetic risk. So if you are Northern European, especially like Irish, they do have a very, very high rate of alcoholism. It is genetic. But alcohol can be addictive. Alcohol is cheap, at least in Lebanon, and it is something that people use to self-medicate, mostly anxiety and insomnia. So many of the people who end up having alcoholism are people who suffer from underlying anxiety or insomnia, and they consume the alcohol as a self-medication, not just to have fun or when they go out or to have a good time. And that leads to the dependency.
Yeah. Let's go back to drugs, though. Do you think that those drugs that we talked about should be legalized in the Middle East, like they are in many states in the U.S. and Canada, in terms of, the patients that you see? Would that make a difference in any way?
Legalization of drugs is a big debate and concept because you have many stakeholders. You have society, you have, in our region, religion has a powerful influence, the law, and many other factors. But if you look at at the problem from a strictly medical point of view, if you have adequate risk warning, education, and people use some drugs which might not be fatal in, let's say, overdose, like, for example, heroin, you can apply the same concepts you apply to alcohol. So alcohol is legal, you're free to drink, but however, if you have a car accident under the influence, you are liable. So if you can use cannabis and not get intoxicated and cause problems, it feasibly can be something that can be tolerated as a legal or semi-legal thing. Definitely in Lebanon, they are less harsh now legally in the legal system towards cannabis use.
So how do you treat people that come to you with either alcoholism or drug addiction?
Yeah, the first step is to see where the person stands.
In your office, in the street?
So let's say somebody walks into my office.
Yeah.
And it depends on who brought them in. Did they come in by themselves? Is it like somebody who wants to stop the substance and they are actively seeking help? And these people do the best. If you're dragged in by someone and you are not convinced, it's really very hard. Some people sometimes are under the influence and they cannot function or even give consent. And these sometimes individuals end up being hospitalized because they could be psychotic, having a severe reaction, and we actually have to put them in the hospital until things calm down. And some people go to rehabs. The rehab concept still exists. It's not very common in Lebanon, but some people do go to rehab. You can check yourself in, stay for a couple of months in a safe, calm environment. But many of these people, when they leave, they tend to relapse. You see that among celebrities frequently. They get into trouble, check into rehab, just hang out for a month.
But what I mean is specifically, like, what's going on in a rehab and what do you do with your patients that you're helping them? Because I would think that it's like either you want to stop or you don't. And how does it help to go see someone? What's your role in the decision making?
The concept that is applied now in addiction medicine, there's the field of addiction medicine, is the concept of harm reduction. So first of all, you have to evaluate the situation. Is the pattern or amount or the way you are consuming the substance, is it dangerous? Is it hurting you? And you need to educate the person. Some people are not aware of some risks or hazards or dangers. So the first step is open, honest communication, educate the person, see what they want to do, and give them options. So some people choose to cut down, and that's fine. That's acceptable if it's less problematic. Some people want to stop completely. Some people are ambivalent. And sometimes you tell them, you know what? You have all the information, all the options now. Why don't you go home, think about things, and maybe we can meet in a week or so and reevaluate. So some people go and never come back. Retention rates in addiction medicine are very low. Success rates are low.
Like what are you talking about low?
It's hard to win the battle against addiction from the first attempt. So many people relapse, and it's a very challenging thing to treat. People sometimes quit. Sometimes people are sober for a couple of years. They relapse. Addictive behaviors tend to linger and lurk in your brain. They never disappear completely. So you could have a unconscious trigger. Somebody might trigger you. You might meet an old friend who used to smoke up with, and you end up smoking again. So I have a patient who was sober from alcohol for 10 years. He had a drink at his son's wedding and then proceeded to drink for another 10 years.
Wow.
So sometimes small triggers happen.
Yeah.
If people are willing to get treated, we have a bunch of options. We can do therapy. I do some counseling, but we have some specialized counselors who work with us who do intensive counseling. So we have this program for 8 weeks. You have twice a week you have individual sessions, almost 45 minutes of counseling, and then every other day there's a group. So intensive psychotherapy and counseling helps treat addictions.
I don't really know what you mean by counseling and psychotherapy.
Okay.
What do you mean counseling?
So there are obviously many types of psychotherapy or talk therapy.
Yeah.
From the classic stereotype where people sit on a couch and a doctor or therapist listens. That's psychoanalysis, like Freudian. This has fallen out of favor. It's not practiced a lot. So the common types now are something called CBT, cognitive behavioral therapy. And this is problem-solving based, trying to find links and associations between using, why do you use, how do you use, what are the triggers, what feelings go away when you use, and to try to find alternatives. So, and this is the therapist and the person set goals, and they work toward these goals. Sometimes you can get homeworks, assignments. Another type of therapy is called motivational therapy, and this is to push people into stages of change. So some people are resistant and they're contemplating, maybe I should stop, and then they say, okay, I want to stop, but I don't know how, and you help them go through the stages. Usually it's done under the supervision of a psychiatrist or a doctor to see if there is need for medical interventions. Some medications do help. For example, like if you take heroin, it's physically hard to stop.
Yeah.
So there is an element beyond craving and psychological and placebo effects. So there are some medications that can be used to minimize the discomfort and help people not relapse. Some people just cannot tolerate the physical withdrawals, and they go back and
do you
use.
prescribe medicine for any of the other drugs?
Yes, there are
alcohol or
we have some actually medications
cannabis.
for alcohol.
You do?
Yeah, there are a couple of medications. Some of them are alcohol blockers. So
Okay.
if you take this medicine,
You don't feel the alcohol?
no, if you drink, you will like instantly vomit and have diarrhea.
Oh,
So
yeah, that
it
sucks.
will like force you not to drink.
Unless you don't take the medicine.
Yes. So this actually medicine is reserved for people at high-risk jobs. So let's say you're a pilot.
Yes.
And they stop you.
Yeah.
And you're drinking on the plane, and they give you like one more chance.
I mean, have you met pilots who are drinking a lot in your practice?
Well, I have when I was not in Lebanon.
Oh.
In Lebanon, it's extremely rare. But I practiced for many years outside in the U.S. and we see pilots,
Interesting.
people who work in high-risk jobs. So these people, they would be mandated by the airline nurse to take the pill under supervision.
Wow.
So she would like give him the pill. So he cannot not take it. And you have other medications that can block cravings for alcohol. We have definitely a bunch of medications for heroin and or opiates, especially if you've heard about the pill addiction problem in the U.S. So like morphine-like pills and painkillers, tramadol. So you have...
What are the names of some of those?
In Lebanon, the most common substance, pill-type substance, is called tramadol or tramal. And it's very widespread in the Middle East. It's cheap. In the U.S., you have OxyContin and oxycodone. So that's the pill we have in Lebanon. We do have treatment for heroin-type addictions, but it's hard to get because the system mandates you get them through the government. So people are resistant. You have to go sign up at the Ministry of Health in this database, and so the privacy is gone, and you go and they give you that special medicines called Suboxone. And most people don't want to go through that system.
Because then you're like marked for life. Everyone knows.
Yeah, and then, you know,
had that problem.
and going and queuing in line to get your papers done. And once you do that, you can get it prescribed from your doctor, but you have to go every once in a while and get it renewed.
And they don't have
stuff.
like wasta there, like.
No, it's quite strict when it comes. That's one of the few things where it's quite strict.
Yeah. So that's the difference, right, between a psychiatrist and a psychologist. The main difference is the ability to prescribe medicine?
No, the simplest difference is a psychiatrist has to be a medical doctor first. And you have to go through medical school, graduate, become a medical doctor, and then you can specialize in mental health, which
I see.
makes you qualified to become a psychiatrist. A psychologist doesn't have to go through medical school. Most practicing psychologists have master's degrees. Some of them have PhDs. So
it's better to be a psychiatrist.
I guess. As I'm biased.
Do you treat people though like psychologists do? I mean, do you have a sofa in your office?
Yes, I do have a sofa, but I do
Yeah.
not use it. Psychiatrists, at least the ones who trained in the US like me, have training in therapy. So there are some patients I see who do not need or take medications, and we meet for talk therapy and counseling. Sometimes we do some couples counseling. Sometimes you have couples who are addicted,
Yeah.
and they feed each other's addiction. So one person wants to stop and the other one does not. And it's very, very problematic if you want to stop drinking and your partner is not, and they drink in front of you.
They should just leave each other.
Sometimes actually that's what
What you recommend.
what the recommendation is if the person is not cooperative.
So I interviewed this doctor in California a couple of years ago. Her name is Molly Malouf. We talked a lot about microdosing, things like cannabis and also acid. I don't know what the scientific name is.
Lysergic acid, LSD.
LSD. So people are using this stuff to like enhance their performance, both like physical, like runners are using it, and then Silicon Valley types are using it so they can stay up all night and be super creative. Some people use it on Sunday to go to the museum. It's called a museum dose, and it enhances the experience. Have you heard of this? Do you where do you stand on that whole thing?
This concept has been around for many years. LSD was invented by Timothy Leary in the mid-60s. He was a chemist at a major pharmaceutical company. So lysergic acid, LSD, makes your brain make more serotonin and dopamine. And when your brain is flooded with these chemicals, which you have, but they come out in large amounts, your perception of sensations becomes different. So colors become more intense. You can have enhanced even like sense of smell, tactile. Sometimes your senses get mixed up. So you get something called synthesias, where you can hear colors and see sounds. So this is why these drugs are popular at raves. Because at raves you're bombarded with lights and sound. So theoretically, these types of drugs, the hallucinogenics, are not physically dangerous. And if used in small amounts, probably they will enhance your perceptual feelings. They don't tend to be addictive. The problem is it's very hard to find, and these things are really hard to make. And most of the stuff that's available are counterfeit drugs, which are made in shady, dangerous labs, and you don't know what you're using. So that is where the danger lies. And if you have an underlying mental illness, it can be triggered. So if you have an uncle who has, let's say, schizophrenia, you probably should not use that stuff because it can trigger something. Or if you have like a sibling who has bipolar, you probably should avoid using that because you might have a genetic risk.
So what are some of the other types of addictions you deal with?
We are dealing with a range of addictions, from behavioral addictions to...
What do you mean?
So they can range from gambling, which is quite common in Lebanon. Actually, gambling is a huge problem in Lebanon, but it goes completely unnoticed.
Where do they... I've never heard of it. They go to the casino?
We have people here who are in massive amounts of debt. There is like illegal gambling going on, from
poker
friends
games.
who play poker for fun to people who are playing high stakes poker at home. There is sports betting in Lebanon. It's underground. They bet on soccer games and all that stuff. There is pornographic sexual addictions. They are quite prevalent. You're seeing it more and more now as the availability on the internet is widespread.
Mm-hmm.
Do
you see a lot of those people?
We do. It's for most people, it's embarrassing and shameful.
Yeah.
And,
so they probably would be less likely to come and seek your help.
Yes. Sometimes they're brought in by a partner. Usually, most likely, it's in most of the 99% of the cases, it's young males.
Yeah.
So usually a partner, a wife, or somebody finds out and they seek help, and it's usually they try to cover things up. You have lots of gaming addiction, PlayStation. We've had like dorm kids who did not go to class for like days on end playing online games.
Actually, I was listening to this podcast out of Dubai called Hamburger Generation. Basically, it's about like that generation that's on fast food and video games. And this guy was telling a story about how obsessed he was with, I think, UFC games when he was in high school, when it first went like online.
Big online games where you can like play with your friends, you're all playing together. They release lots of dopamine, and dopamine is what fuels addiction. So you just keep on playing and playing and playing, and you want to like get more achievements and more points. And you can also like expand the definition now, include food as an addiction. Mm-hmm. So definitely we have people who are addicted to food, and that is part of the obesity crisis. Food releases dopamine. So again,
could you be addicted to someone, to a person?
Some people believe that the concept of love, as we might perceive it, is obsessive addiction, and it can lead in extreme cases to stalking, where you cannot stay away or accept the other person's rejection. Closeness, physical closeness, and the concept of love is fueled also by dopamine and oxytocin. Incidentally, oxytocin is what a woman release when they give birth and breastfeed, and it causes bonding with the child. So people who have high oxytocin levels sometimes can get dependent and addicted to others.
That's so interesting. That's so interesting. So dopamine is what is basically the common.
Releases oxytocin. That's why it's important for the baby and the mom to bond.
Yeah. So for example, like I add like hot peppers on everything I eat and it burns and I just want to eat more. Could that be like an addiction?
Yes.
Am I addicted to hot peppers?
It could be. Peppers are psychoactive. So they do have a brain effect. So they do release serotonin, dopamine, and adrenaline levels. Probably what you are addicted to is the adrenaline. So if you eat large amounts of pepper, especially like, for example, cayenne pepper, cayenne can actually push your heart rate up if you can feel your palpitations.
Yeah.
So the adrenaline rush from peppers is like bungee jumping, but
is it
tastes
bad?
better. It's not dangerous, but there are some rare cases. Be careful of people who had like heart attacks from too much pepper.
Well,
Very rare.
I would say that's the second best way to die.
I'm not going to ask what the first is.
Yeah, well, so is it a taboo to be an addict?
Actually,
and in the Middle East, do you think it's more of a taboo, let's say, than in the West? Are people more reticent to talk about it?
But again, I can tell you, and I practiced psychiatry in the U.S. For more than 10 years, and there is not much less of a taboo. So, but definitely here we have even higher stigma, let's say. So the term actually in Arabic is very derogatory. Like the term in Arabic is mudmin, amma al-idman, amma bit'ata. And being an addict is synonymous in the Middle East to being a criminal, like rapist. It's lumped in with the antisocial undesirables of society. In the US, the term actually has been changed. And now actually the medical term, and we should, even for myself, it's hard to train myself to use it. It's called SUD, substance use disorders. So this term is less stigmatizing than addiction. Because again, an addict implies... Yeah. Again,
it has a negative,
bad
yeah, definitely.
So the
SUD.
The preferred term now is substance use disorders because you are misusing a substance.
Yeah.
Definitely there is stigma. People in Lebanon and the region, we also have criminalization. So it's not just a stigma. You can go to jail.
Yeah.
So at least in the West, they have decriminalized it unless you are actively selling drugs. So yeah, in Lebanon you can get in legal problems, and that's not going to be good for your career, especially if you're a young person. It gets stuck on
Definitely.
your record.
I'm going to ask you a personal question. What are you addicted to?
I am addicted to...
Don't give me like BS. I'm addicted to flowers and fashion.
I'm addicted to the internet.
You are?
Yeah, I'm addicted to information. I like...
like how much time per day do you spend?
A lot.
What's your screen time?
I want to turn off that thing, and it's like... even my wife the other day was...
commenting?
Brought it up. And,
so when you see your screen time, how many hours per day are you spending?
A lot of hours. I read compulsively news, science articles. So sometimes I feel my brain is overloaded. And it is an addictive
like
behavior.
8 hours.
And incidentally,
more?
I do like peppers too and chilies.
You do?
And,
oh, okay.
So, but I don't think I'm addicted to it. Definitely, you can be addicted to work. An achievement.
Yeah, you're changing the subject now about your internet
I am addicted
addiction.
A little bit too. I am addicted to my job, maybe.
Yeah.
Maybe most physicians do. And it is gratifying. You do get reward.
Why do you say you're addicted, though? I mean, you have to go to work. You have certain hours that you have to do. How are you going above and beyond that?
Most physicians I know actually do that. We do go in, we do more stuff, we spend more time with our trainees. You just hang around.
At the end of the day, a little bit longer than you have to.
I had a couple of hours free. I just was doing stuff for no reason. So... yeah, you can be addicted to, and I'm addicted to my wife.
That's a good addiction. That's a really good addiction. So there are good addictions and bad addictions, right?
Yeah, but
substance use disorders.
But
yes.
some addictions could be superficially healthy looking, but they could be destructive, like excessive exercising.
Yeah.
We do have people who are addicted to exercising. It can be harmful. We've had people who had fractures from running and they would not stop running. People who spend excessive amount of time at the gym at the cost of family or other duties. And you could be a workaholic too. So anything can be misused or...
Yeah. So it's like basically like for everything else, everything in good measure.
The golden rule, yes.
Let's leave it at that with the golden rule. Thank you for coming in.
Thank you for having me.
That's the show. Thanks for joining. I hope you had a good time. If you want more, make sure you subscribe and follow Hakawati and me on Instagram and Twitter. See you.